This week's Ask Dr. Durie comes from a patient who noticed that there have been new guidelines published for the use of x-rays and scans in patients with myeloma. And the question is, how will these new guidelines affect my testing and monitoring? And the answer to this is that this is really important, and there are very detailed and important changes that have occurred from these recommendations. And so, number one, for baseline testing for myeloma, we routinely use what we call full skeletal survey, x-rays of all of the bones in the body. And this is a very cumbersome test, but as it turns out, not the most sensitive test for this sort of bone evaluation. And so a new test, whole body, low dose, CT scanning for all of the bones in the body is definitely a more sensitive testing and picks up 20% more lesions than just regular x-rays. And so when and if available, whole body, low dose CT scanning should be considered. It's more efficient and safer than the regular x-ray procedure. For monitoring of active myeloma, to assess at the start of the disease and throughout the course of the disease if there is active myeloma present in bone or even outside of bone in the soft tissues, whole body PET CT scanning is definitely the way to go. It is more sensitive. The sugar uptake into the active lesions gives a clear indication of the presence of active myeloma cell growth and is a very, very key aspect of testing. So whole body PET CT, very important. And then the final testing, MRI of the spine and pelvis, which can be used as an initial screening procedure. This is now recommended to be considered in patients who might have smoldering myeloma but possibly are moving into a more active myeloma phase. And so the finding or presence of two or more lesions, little areas of involvement on an MRI scan, indicate the presence of a myeloma defining event or a new indicator of what we call early myeloma deserving of myeloma therapy. And so the bottom line for all of this related to imaging is, please spend some time to talk to your doctor about what scans and x-rays will be used to assess myeloma in your case. It's extremely important to set up a plan so that regular monitoring can contrast and compare the initial findings done at the time of diagnosis with serial monitoring throughout the course of the disease.